All right, again, thank you. So this is the session on outreach to the unsheltered, engaging, listening, and persuading. I'll start with introductions. So we are joined, we have two panelists from the Kauai Malama Pono Health Services. First is Charles Rossler, the Associate Director and Grant Writer for Malama Pono. Charles is a Kauai native and has worked in the nonprofit sector for 5 years as a program manager, grant writer, and case manager. He received a master's degree in social work from Hunter College in New York City with a focus on administration and mental health. Charles's enthusiasm for the nonprofit sector arose from an undergraduate course that worked on in partnership with Dignity Village, a city-sanctioned village for houseless individuals in Portland, Oregon. And we're also is Ramon Meraz. He's from Chihuahua, Mexico, and transplanted to Kauai via Oahu after growing up in California. Originally a hospitality worker, he went back to school hoping to get involved in planning for a better future. Ramon spent a year at the mayor's office with AmeriCorps in the housing office. Ramon was recruited to work as a tobacco health education manager for Malama Pono Health Services. He enjoys outreach all over the island and is currently taking classes on motivational interviewing to improve his impact with program participants. And Charles, if you'd like to give an introduction to Malama Pono Health Services.
Sure. Thanks, Michael. Aloha, everyone. So Malama Pono Health Services, we're a nonprofit agency on Kauai. We started off as an AIDS service organization, and over the last 30 years have really grown. Now we offer HIV, STD testing, treatment, and counseling, women's wellness services, tobacco cessation services, harm reduction services, including needle exchange. And then we pride ourselves in being able to refer out to other local agencies for important issues like domestic violence and substance abuse.
Thank you very much. We're also joined today by Castro Masaniai from the Institute for Human Services. Castro started working at IHS in 2014 as a guest service assistant at the men's shelter. He has transferred to the outreach department in 2016, where he is now the outreach program manager. So, Castro, if you'd like to give an introduction for IHS.
Hey, it's still morning, right? Yeah, good morning, guys. My name is Castro. I'm one of the outreach program managers at IHS. So IHS in general is I guess you can say one of the most comprehensive homeless service providers that we have on Oahu. We have about 200 staff over here and provide services like outreach, like what I do, shelter, case management in shelter, case management out in the community, kitchen, housing, all that stuff. So usually if there's any issue with some kind of homelessness, we tend to be the ones that do get involved. Or if not, then we can kind of send it out to the appropriate guys. But yeah, in a nutshell, yeah, we're one of the bigger homeless providers on Oahu.
Thank you, Castro. And our last panelist is Art Miner with the Department of Veterans Affairs. Art has lived in Hawaii for 16 years and earned his master's in social work from UH in 2010. He's been working for the VA on Oahu as an outreach social worker with homelessness programs for nearly 6 years and has been a licensed clinical social worker and certified substance abuse counselor in the state for 7 years. Art, if you'd like to give an introduction to the VA for those who don't know much about it.
Yeah, good morning, everyone. So VHA services, so we have a medical center here on Oahu. We have several community-based outpatient centers on the neighborhood islands, Maui, Kauai, Big Island, Kona, and Hilo side. So specifically for homeless program services on Oahu, myself and another coworker, social worker, cover the entire island for outreach, along with 2 peer specialists. And it related to homeless program services, we have emergency housing for veterans, transitional housing on Oahu for veterans, who IHS and US Vets both contract with us for those for those services. Let's see. So there's, along with the those services, there's the HUD-VASH program, the Section 8, which is one of our bigger components of the homeless program for VA. And so that is essentially case management, wraparound services, along with the assistance with finding housing, maintaining housing, and whatnot. We also have employment-related services with the homeless program, and veterans justice outreach services for veterans that are experiencing legal issues. And just with the VHA in general, that includes like healthcare, medical care, mental health care, substance abuse treatment, IOP, substance abuse, referral to residential programs. And then on the VBA side, that's veterans benefits, GI Bill, disability pay, non-service connected pension, other like loans and stuff like that. So that's kind of us in a nutshell.
Thank you very much. Appreciate that, Art. All right, so let's get started with the panel. So I'll switch to the next slide. So we'll do roles and goals. So I'll throw this to Charles.
Okay, so I'm sure all of our organizations are going to look a little bit different on what does a typical day look like for doing street outreach. So for Malama Pono Health Services, we basically do a lot of our outreach through a mobile health unit. A few years ago, we've been doing outreach for a long time, but realized that not having a clinic out in the field was hampering some of our service ability. So with the mobile health unit, it's a retrofitted Sprinter van that is equipped to offer multiple services out in the community. So we can go out and provide testing, treatment, and even limited well woman services. So with our mobile health unit, we try to go out at least twice a month. But we have been going out since COVID-19 4 times a month. So there's actually designated on the island of Kauai, there's designated safe zones for the houseless population, including, if you know the island, Anini Beach Park, Lidgate Beach Park, Salt Pond Beach Park, and Lucy Wright. So we try to hit all of these twice a month to ensure that we can go over there, one, build a rapport and make sure that we're there at the same time so that people are used to us being in that community. And then also being able to provide treatment, which usually takes 2 weeks for us to find results and stuff like that. So I know I mentioned our services in the beginning, but as far as what's offered through the unit is a little bit limited. Obviously, we can't do any cervical cancer screenings or anything like that. So we offer like limited well women services. We do all the HIV testing, tobacco cessation, and then harm reduction. And what we're really excited about is what's going to be coming soon is we're going to have a nurse practitioner doing wound care and then doing some MedQuest enrollment too, because we see on this island that we really need to get people signed up for some type of medical insurance so that they can have more accessibility to services. And as far as what are some goals when we encounter a homeless individual or an unsheltered individual, I think first and foremost for us is creating a rapport and developing trust. Without that foundation, it's hard to really get anywhere and delve into the issues that these individuals really need help with. So on top of that, it's connecting individuals to agencies that provide housing services or assistance, and then having a great knowledge of what's available here, communicating with other agencies, making sure we're referring people and not referring them to the wrong place where they kind of get disheartened or a little frustrated with the system, especially with all the things they're dealing with on the day-to-day. And like we said, so a lot of times when we go out there too, we understand that what's lacking on our island in particular are mental health and substance abuse services. So connecting them to insurance or some form of greater accessibility is huge for us. We have one inpatient facility here, one full-time mental health facility here, so it's extremely limited for the individuals here, especially without insurance. And I'll throw it over to Art for what they do on a typical day.
All right, thanks, Charles. So yeah, typical day. All our days are typically different depending upon referrals we've received from a lot of our community partners, IHS, Galip, Lama, US Vets. So yeah, typically start the day checking emails, going over phone calls, following up on any immediate needs. We get calls from hospitals quite often in regards to some of our patients that may be hospitalized. And then typically street outreach, going around. It's been more targeted lately due to the pandemic, trying to avoid the face-to-face time as much as can, but obviously we still have to go out there and see our guys. So yeah, engaging with the guys we have been engaging with, the males and females. Yeah, and typically when we do encounter someone who identifies as a veteran, it's to our first step is verifying their eligibility, making sure that they have a service record, that they're eligible for VHA services. Once we're able to do that, we will typically try to complete a VI SPDAT with them to get them referred to homeless program services, assessing where they're at, what their needs are, trying to figure out what their income is. Are they eligible for income through the VA, disability, non-service connected pension? Seeing if they're interested in shelter placement, transitional housing placement, seeing if they may be eligible for our permanent housing program, depending upon income and other eligibility criteria. So yeah, every day is real different. Myself, I cover Windward and Honolulu side of the island, so those are my stomping grounds. So just like earlier this week, I was in Waikiki for a big portion of the day, then Mo'iliili and Chinatown. So trying to locate our veterans, trying to get them needed documents and whatnot. And yeah, that's pretty much our goal, is just, assessing what their needs are, where they're at, trying to meet them where they're at. And like Charles said, building rapport is that's huge. If you don't have that rapport, it's going to be real hard to, build that trust and that therapeutic alliance with them, to really assess where they're at and what kind of services they want and whether or not they can trust you to get you those services. And yeah, with that, I'll see if Castro's got anything to add.
Sure. I feel like you guys pretty much covered most of everything that we do, at least. But I guess you can say for us, typical day looks like usually out in the field half the day, then we're back in the office or at home, kind of working on charting or all the paperwork that we have to do for that particular day. But yeah, so we're usually meeting the clients where they're at, whether it's out in the streets, hospitals, in their family home, in the backyard, or even in the mountains, or in these crazy places where you would expect homeless folks to be. And as big as I am, I will find a way to get up there. It might take a while, but I'll find I'll be up there. But oftentimes we do collaborate with other agencies as well. I believe Art had mentioned he does outreach on the Windward side. I also do outreach on the Windward side as well. And anytime we do, let's say, run into a veteran, we're always contact him, see if there's a way we can link up, especially if they haven't been connected before. So, this whole homelessness problem isn't something that we could do on our own. It's one of those big collaborative things that, all these homeless service providers on island are working together to kind of accomplish that goal. But let's see. As far as the goals, yeah, they pretty much hit the nail on the head already. Establishing relationship with them, ultimately housing or getting into some kind of treatment program, depending on your assessment. Getting them off the streets is the ultimate goal, but it will be difficult to get to that point unless we establish some kind of relationship with them from the beginning. Because without that trust, without that rapport with them, you probably wouldn't get too far with that individual. So that's pretty much it.
Thanks. All right. So let's move on to strengths and challenges.
Oh, sorry. Should we see if Ramon's got anything to add to sorry, don't mean to put you on the spot, Ramon, but
No,
Sorry.
absolutely.
Thank you very much, Art.
No, for me, it's a little bit different because our program, just like Charles was saying before, is for everybody. So it's for people who are houseless and people who are housed, but they might need needs. They might be low income or etc. And so we have a program that is for everybody in our island, and that is part of what the goal for me is, that the people that we encounter. In this case, when my days that I go out and do outreach at the encampments, that they know what they are entitled to, that what does it mean, and that they can get it for free, and they can make the decision to join the program. So that is my goal always, that people know that they have the right to enroll and receive nicotine replacement therapy. So I know that's very specific.
Sure. Thank you, Art. Appreciate that. So moving on, slide 3, strengths and challenges. Art?
Hi. There's a lot of strengths that you can see with the homeless population. Oftentimes they're very resilient. They've been in really difficult situations. They're still surviving. They're still here. They got their street smarts. You've got to be pretty savvy to be surviving out there. It's a rough environment out there, that's for sure. Some of them may have knowledge about services. Some of them have external supports. So yeah, that's kind of some of the strengths. I don't know if I'm missing out on anything in particular there, but yeah, feel free to jump in if anyone else is noticing any other strengths that they're seeing. And then some of the needs, oftentimes it's food, clothing, shelter, getting their basic needs met, hygiene items, case management, medical care is huge, substance abuse, mental health, treatment, medication. And along with the case managements, a lot of it is, getting them linked up to services. And like Ramon said, just letting them know what they're eligible for, what services they are eligible for. Some of them may not even know about the food stamps or general assistance, or maybe they don't know they're eligible for a non-service connected pension. And so yeah, assistance with like all those type of applications, the SNAP, the general assistance, disability apps, assistance with obtaining income, getting vital documents. That's a very big one for us, especially if they're trying to get into housing, so trying to get them the vital docs, like an ID, for us, DD-214s, birth certificates, social security cards, all those related items. And it's definitely been a little more challenging with the pandemic going on to get those documents. You need one to get the other oftentimes. So yeah. And then challenges. So some of the biggest challenges personally from our street outreach, the co-occurring conditions, the mental health, the individuals with psychosis. Oftentimes those individuals are service resistant. They won't want mental health treatment. They don't want potentially even housing, medical care, stuff like that. Sometimes, just severely detached from reality, unfortunately. And then on the related to that, appearing, oftentimes you have individuals that appear to lack decisional capacity. It doesn't seem like they're able to make decisions in their own best interests. And along with the mental health, the substance abuse is huge, when they have co-occurring mental health and substance use issues, which can obviously complicate their mental health symptoms, make them more severe. Hard to pinpoint what comes first, the chicken or the egg, so to say. So sometimes it's substance-induced psychosis, sometimes it's organic psychosis, and it may be real hard to differentiate what's going on, especially when we don't have like a true baseline for them. Isolation in some cases. Some individuals are, like up in the mountains, kind of isolated from society and services, and can be hard to access. A lot of our individuals don't have phones, so they're extremely hard to locate. They change their patterns where, typically there's areas where we can find them, and then all of a sudden, like, they're not in that area anymore. They've totally shifted to where they've gone, and they don't really have any other providers they may be working with, or haven't informed anyone. So yeah, and individuals with significant medical issues too, hard to get them care oftentimes. Accessing appropriate level of care settings for them, dealing with individuals prone to aggression and violence. And I will use something that I've heard Jerry Coffey say. He's referred to, the three kind of categories of homeless individuals. You have the have-nots, the will-nots, and the can-nots. And it's the will-nots that are often the most challenging. The ones that are refusing services, service resistant. We have some individuals that won't even accept their income, unfortunately, that they are entitled to, they've earned, just due to, significant mental health conditions. So yeah, and then, oftentimes it's just that building the rapport, trying to work with these guys. I was thinking of an example. We had a veteran that was at Ala Park for, several years, and it just kept that constant engagement. We assisted him in getting some income through non-service connected pension, getting him other necessities, hygiene, and stuff like that. And eventually he was willing to accept, housing, and he is in our Section 8 program now. So yeah, sometimes it takes a long time to work with them and get them to build that rapport and trust, and to assist them in getting where they want to be. And I don't know who would want to jump in there for the strengths and challenges. Charles, would you like to jump in there next?
Sure. That was really comprehensive, Art. I don't know if I could really add to that. I think you covered absolutely everything. There's one thing I want to say. There's one service that I missed out that I feel terrible I didn't mention, is the trans services we do here with outreach. They're disproportionately affected by substance abuse and houselessness. So I just want to pinpoint that we do offer those services. And just to continue on, I mean, the last thing I really want to highlight that makes me so proud to be able to work with this community is really their strength that Art, really talked about in the beginning, just living out in the elements and being that resourceful. I think that's overlooked a lot. I know that when I look at myself, I don't know if I'd be able to handle half the things that houseless people go through on a daily basis. So I just wanted to highlight that. And then I'll pass it over to Castro.
Yeah, thanks, Charles. It's pretty amazing how resourceful these folks are. There's an encampment out in Waimanalo where these folks, they kind of take turns trying to grab water. And you can see them just riding their bikes with empty bottles of empty gallon bottles to wherever water source they have, and turning back. They kind of rotate. I thought it's pretty cool. I guess you could say that's one of the strengths that those folks have. These folks are in survival mode, and they don't necessarily, I guess you can say, want any help, at least at that moment. They're very resourceful. I think as far as challenges go, I think I pretty much hit on it already. A lot of the issues that we have, well, not so much issues, but challenges, is with our SMI clients and those that are really heavy into their addiction. A lot of the folks, they're not willing to get help, but it takes time. I think Art had mentioned it does take a lot of time, and I think I'm pretty sure we could all spend some time over here sharing some kind of success we've had with somebody that we've been engaged with for a pretty long time, and then had some kind of success with them afterwards. So I don't want to get too much into detail with that, but yeah, it does take a lot of time, especially with that particular population. Mon, you have anything to add?
I just want to reiterate. I think that we know this, but it's important to remember one of the most important strengths to have when we are working with homeless population is the rapport, and having that, the channels of communication, that trust, et cetera, et cetera. And so that's something that everything else might fall, but as long as you have that, then you have something to work with. And your challenges, for me, sometimes is maintaining that schedule, because it is so important to always be there at the same time when you told them you're going to be there, and that is something that it can be. I know that for other people might be a little bit different, but being in an island where we are so spread out and we have other programs going on. Now, as long as I keep going to the same places at the same time, then yeah, I keep building a report. So, yes.
All right, thank you. Very good. Let's move next slide. So we have a service resistance. Castro?
Okay, so with service resistance, how do you approach unsheltered or those who are hesitant to accept housing or services? Yeah, we pretty much hit it earlier. I believe consistency is key in building some kind of relationship with these folks. Consistency meaning, you know, you're seeing them at least like once a week, maybe twice a week, depending on who they are, and try to get their immediate needs addressed. Because you already know they probably won't accept whatever kind of treatment because they're not in the right state of mind or whatnot. But yeah, they do catch on. You know, if you're not there all the time, trying to engage them. Let's see. I think another what works. Well, what works. So other than being consistent, I found that especially with our difficult, our SMI population or the guys, you know, really heavy into their addiction, just kind of being creative, just kind of thinking outside of the box when it comes to offering services. There was a SMI client that we had in Alamoana a couple years ago when I first started, and we had engaged her. You know, she's usual. She don't want to be bothered. She just kind of wanted to do her own thing. And I think it took our boss, Justin, at the time. I still remember the story too, but I think what he did was he offered her food. She wouldn't take it, and he kind of threw it out there. You know, he bought food for himself and her, and they were both able to kind of sit down and have a meal together. And I think that's kind of what sparked. Like something kind of clicked in her, and then she ended up kind of coming around. She's been open to services, and they were open. I mean, they were able to get her housed a couple weeks later after that. So it's just kind of one of those things. Like, just kind of be creative, kind of think outside of the box. And I'm sure these folks have their unique ways of engaging their particular clients and seeing what works for them. Now, what kind of being judgmental. Oftentimes we engage these folks that are service resistant. A lot of people, they don't help and whatnot. And it kind of, I guess, a lot of wear and tear on you. You know, you yourself start feeling a little. Well, me personally, start to feel a little, I guess, burned out. You're a little like. A little frustrated, you're kind of dealing with the same thing over and over. Oftentimes, I would find myself a little frustrated working with them, and that I found that definitely doesn't help out with getting them the help they need. And at that point, that's usually when somebody else kind of jump in. Maybe one of my other coworkers jump in, or see if there's any other services out there that we could collaborate with. Could be the VA, could be maybe get APS involved or whatnot. But yeah, hopefully. Charles, do you have any other anything you want to add to this service, this resistance slide?
Sure. So for us, and Ramon's definitely gonna talk about this because he does a ton of that. As much as outreach as we do at Malama Pono, he does twice as much. So he's always out there. And I think, as far as approaching people who are hesitant, not we as providers might see that this service will help an individual, but it doesn't mean that that individual has to take advantage of it or even want to do it. And I think the main thing is just letting it known to them that we're here. We're going to be consistent. We'll be here in time. And if circumstances ever change or your motivation change, you could always come to us. And I think that's one thing where like, oh, okay, I've seen these people here, or my friend over here talked to them and he had a good experience. So they will talk, amongst the population, and how you treat each individual is really going to shape the perception of who you are when you're out there. So I think that's really important. There's always going to be people who are hesitant, and it's very understandable. The amount of barriers that unsheltered individuals have to walk through every day, and it's hard to open up. Their lives are very difficult, and I think along with what Castro said on what I'm jumping to what doesn't work, but just in that judgmental mentality, it doesn't mean that walking out there and it's not like a conscious decision that you're trying to be judgmental, but even just how you carry yourself or how you answer or how you speak goes a long way. So I think it's very important to just be cognizant of how you appear and how you're coming off, because you have to be able to adapt differently in different environments, and the professional environment and how we act and speak isn't necessarily going to work, in my experience, through outreach. And I want to pass to Ramon and see what his insights are on this.
Thank you, Charles. Yeah, I want to add, here in Malama Pono, we say we meet people where they are. So we make no assumptions. We're always friendly, we're respectful, open. If people don't want to talk, then that's okay. We just let them know we're around. If they want to come and talk to us, we're going to be over there. And so that's my approach when I go to the encampments. Then what works is if nobody else is there, then I can start a conversation about something else. But it's so important that when you have an outreach worker, this person has to like people. If you have a person who doesn't like people, it's not going to work, because some things you cannot fake. So important is to listen, is to have empathy, to be able to reflect people's emotions, concerns, what's important to them. So that is so important, to be able to be open to, not just to come over and try to give or receive or tell people, but also to be able to take back. And some people want to talk. Some people are lonely. Some people want them to know that they're, they matter or whatever. And so that is just so important. And in our profession, sometimes we forget that we have to listen twice and speak once, right? So definitely, if people are not taking services, sometimes I just talk to somebody else and say, okay, I'm going to be over there. Talk with somebody else, but make sure that once in a while you smile, you look at them, you include them, and then you talk in broad terms so people feel included in the conversation, and then they can come at their own pace. But what doesn't work? Well, definitely being condescending, definitely not being there when you told them you're going to be there, or when not following through, or not being consistent. That's very, very important. People, even if they say they don't want to receive services, if they see you on a regular basis, they start opening up and they start, maybe accepting you. So as long as you keep going and just being available, that's important. But forgetting about people not going to the same place again, then sometimes they're not going to open up. And the last thing I want to do is say that also sometimes just asking for help. There might be somebody, maybe not even from your own organization, but if they have the report, and I've done this many times with different people, if I see that they have friendships with the people, then I say, hey, can I go with you next time? Can we do something together? What can we collaborate? If you're, talking about this, I can also talk about that, because they're related. And that seems to help over here.
Art, did you have anything to add?
Yeah, just to reiterate a lot of good things discussed there. Thanks to you guys for being very comprehensive. But yeah, just being non-judgmental is very important. Trying to be empathetic, meet them where they're at. Oftentimes we think, hey, these guys don't want housing. Who doesn't want housing? So a lot of times it's just like maybe trying to get their basic needs met, and maybe that's SNAP, getting them food stamps, maybe some general assistance, maybe just hygiene, maybe just like an ID or something like that. And oftentimes that can help build rapport. And maybe in the future they may want services. And yeah, just kind of being there, giving them your card, saying, hey, I'll be in this area next week. If you're around, can I come talk to you? Just throwing it out there. So yeah, just trying to definitely meet them right where they're at, and not trying to, pass on like what we would, what we would do, what we think we would do if we're in a homeless situation. Everyone's different and everyone reacts differently. So yeah.
Thank you. All right, well, moving into the next topic. So COVID-19. We'll start with Charles, how this has changed.
Sure. So COVID-19, how has outreach changed during the COVID-19 pandemic? For us, it's dramatically changed, and it's been constantly changing and will continue to constantly change. So in the beginning, really, it was just almost shutting down our services because we couldn't go out and provide the service. It was right in the beginning of the pandemic. And Kauai, for those of you that don't know, Kauai was very strict in our protocols for who was coming in and who was leaving our island, including what businesses could still function and what couldn't. So during that first stage, it was pretty much everyone worked from home. We did do limited telehealth services at that point. But then as restrictions eased, we always try to take the model of, if we can do telehealth, if we can do social distancing, if we can provide for the safety of our staff and those in the field at outreach, the participants we're working with, we do that. So we continue to do telehealth as much as we could. And then we purchased full PPEs when they were available. The full ones, not just the glove and the mask. We went all out with the whole bodysuit, headgear, making sure you're completely covered. Because for a little bit there in the beginning, we were doing COVID-19 testing also. So our organization really tried to step up during COVID-19 and help, especially the unsheltered community, as much as possible. So from the full PPEs, then currently right now, we kind of dropped that down. So we're doing the mask and the gloves. We also provide that to participants in the field. And then if we can do telehealth, we do, but with the houses community, that's usually pretty difficult. So we go and meet them at the safe zones that are allocated on Kauai and make sure we're there consistently, and we've gone out more often. So like I mentioned earlier, the mobile health unit goes out twice a month to each location. Ramon's actually out there with the tobacco cessation services probably 4 times a month. So a lot has changed, and I'm sure it'll continue to change. And next, how do you balance the need to keep staff safe while continuing to serve those in need? I think I touched upon that a little bit, but it's so key to keep staff safe while we're helping individuals. Of course, we're trying to get our services out to the community, and so many people need it, especially now. But if you don't have healthy staff, you can't provide the service. So you really have to make sure you're protecting for us, our staff, while they're going out there, and then being able to provide services that are keeping the whole community safe. And I'm going to pass it on to Castro to hear what they do.
So let's see. I'm gonna start with the second question. How do you balance the need to keep staff safe? Because that was a big concern when COVID actually hit. A lot of the staff were concerned with going out into the community and doing the regular thing. But we all had our appropriate PPE gear. Kind of did a lot of training and whatnot regarding physical distancing and all that, and how to wear all these PPE appropriately. Um, let's see. So when COVID hit, we were actually still out in the field, engaging our folks at least 4 times a week. But obviously practicing social distancing. But having access to all these resources was a little bit challenging. There were different ways on how to apply for food stamps, MedQuest, applying for somebody's state ID or getting their social security card or whatnot. There was a lot of changes, and those changes we're still dealing with today. But yeah, it's something we've kind of adapted to, yeah, something we have adapted to since this whole thing started. So not too sure if Art or Ramon have anything else to add to all this.
Yeah, sure. Yeah, definitely. Just kind of reiterating a lot what Castro and Charles discussed. The PPE. So we never really stopped seeing patients at the beginning. We were still going out 3 to 5 days a week to seeing patients face to face. The telehealth wasn't an option for vast majority of our guys that are unsheltered because they don't have phones. They don't have a way of maintaining their phones. So yeah, just dialing in the PPE, making sure we had the face mask, the gloves if we're completing paperwork. That's never really changed because still, like, for Social Security, to get a ID, to get birth certificates, any of these identifying documents, you still need a wet signature. There's no way around that. Applications for food stamp, general assistance, disability as well. And so yeah, using the gloves, the PPE, our masks, our the face shields, the goggles, trying to maintain that 6-foot social distancing, which oftentimes it can be difficult. The one kind of saving grace for us is that we are outside, so it probably helps minimize the potential transmission of the disease. And then yeah, making sure if you have them sign documents, we have throwaway pens or pens we can just give to them, putting them in plastic bags and trying to make sure they have time to potentially the virus or the particles may not be on those items anymore. Yeah, lots of hand sanitizer, obviously. I feel like I'm forgetting something. Yeah, at first we totally stopped transporting individuals that we used to do. That's kind of been on a need to be basis, especially for important documents or potentially trying to get them into emergency housing or transitional housing. And trying to minimize the time you spend face to face with those individuals as well. And obviously the screening is huge. Screening the individuals before you have prolonged contact with them, and contacting the necessary medical providers if they are symptomatic, and getting advice on where they can go to get tested, how they can isolate, how they can potentially quarantine as well. I don't know if Ramon has anything to add to this, or if Charles covered it all the way.
All right, then I will move to the next slide. So for Art, service gaps.
Okay, service gaps. So we with the VA, we're pretty comprehensive in services that we have for veterans. There have been kind of some service gaps I've noticed, including like appropriate level of care settings being available, readily available, individuals that need assistance with their ADLs, IADLs. It's been difficult because those level of cares aren't always available, and it can be really difficult transitioning someone from being unsheltered into one of those environments. And some of the other difficulties I've noticed during the pandemic. Individuals with jobs, if we're trying to get them into emergency housing, it can be difficult because we want to make sure they still maintain their employment, still working. However, given the quarantine requirements, it can be a difficult transition into emergency housing. And kind of, I guess, overall, I guess this is looking at homelessness altogether, like a multifaceted approach. Just obviously jobs with living wages is huge, affordable housing, and income where they can, afford all the amenities, food, clothing, shelter, all that kind of stuff. As far as outreach goes, I mean, I think there's a lot of services out there right now that do seem readily available. I guess accessing, substance abuse treatment is always a challenge, can be a challenge, having a bed space available, medical care to those that are real vulnerable and cannot get into the clinics or cannot be, seen or need to go places to get care. Mental health care on the streets is a big one too. I know agencies like IHS do have psychiatrists that go into the streets and see individuals with mental health issues and whatnot. And what ways could we improve the system? I mean, I feel like the system's pretty good right now. I guess there's always room for improvement. But just the overall, affordable housing is huge. So we definitely need that more affordable housing for sure. And just, probably subsidies for those that cannot work, that have limited incomes, for the overall population. That's kind of where I'm at with that. Anyone else got anything to add? Castro, Charles, or Ramon?
You pretty much said exactly what I had written down, so you're good.
Yeah, for us, it's very similar too. I do want to really highlight the lack of affordable housing. When we go out to our unsheltered populations, a lot of them do have jobs. They just prefer not to pay that much money for rent, so they can afford other things, and that's kind of an eye opener. So I just wanted to add that.
Thank you.
If I can add one last thing really quick is IDs. We need to keep that at the forefront, that people lose their IDs all the time. So somebody has to come up with some kind of system, maybe a fingerprint or something that can make it easier for people to get their IDs when they lose them. That's it.
Yeah, that's very important, Ramon. Thanks. I totally missed that. But yeah, just accessing those vital documents is huge, because that can prevent them from getting into housing, obviously, and accessing services. So that's a very important kind of service gap and things that could help potentially change the system.
Thanks. Thank you. All right, moving on to next. So good neighbors, Castro.
I'm gonna try to keep this simple. When people in the community encounter homeless, what can they do to help? If you're up to it, engage them, get to know them. Oftentimes they're brushed aside and dehumanized by society. Everybody ignores them, kind of just pass by without even acknowledging them. So a simple hello, good morning, that alone would do a lot. And I know for a lot of the local folks that are watching this right now, there was a radio show that there was an artist that presented on the show, and she's kind of pouring out her heart, sharing a story, a very heartfelt story about her struggles with homelessness. And I believe the hosts were kind of clowning on her. Please don't be that guy that clowns on them. These folks, they're really looking for somebody to talk to, and engage in. And when you listen to their stories and you start to be a little judgmental or whatnot, that's going to turn them off, and they're really going to shut down on you. So engage them like you will anybody else, and that alone will do a lot. So go ahead, pass it on to Ramon. You got me.
Okay. Anything from Charles or Art? All right. Oh, sorry. Go ahead, Art. Apologize.
Oh, sorry. Yeah, just what Castro said. Treat them with dignity, respect. They can obviously reach out if they encounter a veteran. Reach out to myself or my coworker Mark Jerem. I'm sure they could reach out to IHS, Khalif, Lama, depending upon what areas they're in, and we can try to engage with them. Obviously, just treat them like they're a human being and be respectful, and that can go a very long ways.
Thank you. All right, and our last slide here contains some resources. So there's a phone number here for a National Call Center for Homeless Veterans, as well as a link to the Oahu Homeless Help Card. That's something that Partners in Care actually, you can get in touch with us if you want actual physical copy of that. I think IHS has a bunch of them too, I believe. So yeah, feel free to reach out if you need anybody. So with that, I'm going to bring the presentation to an end, and then we can go into questions. Just a moment. Let's see. Sorry. So let's see. We have 3 questions. So first one, how do you handle the transportation of clients with COVID? Does anyone want to take that?
For us, with outreach, we don't do that just because we don't have the proper PPE to deal with that. That would be utilizing emergency medical services on our end. I'm not too sure how other agencies are doing that.
You know what? It's funny because we just got a van that's kind of catered towards all this. It's actually more of wheelchair accessible van, but they kind of set it up in the sense that there's like shields across each seat. So we've been using that to transport our clients as well, but to make sure the clients are wearing the appropriate PPE, and we're also doing the same as well. So.
For us, we really don't do many transportation services in general, but if someone does show an extreme need, we usually utilize Uber through our certain programs. We can utilize Uber and then pay for it that way on our end, so we make sure that they can get to where they need to go.
All right, next question. What kind of supports are being provided for those found in the community that are seniors? Ramon?
Yeah, absolutely. I just want to say that's why it's so important that as providers, we know what our colleagues do. If there's organizations, we don't specifically work with seniors, we work with everybody, but there's something for seniors. We need to know the Council on Aging. We need to know all the different organizations that might help them so we can connect them. And so, yeah, again, we don't do senior services specifically, but we definitely need to be knowledgeable.
Yeah, so for us here, like one instance of that is like Project Vision here on Kauai. They'll help with glasses and stuff like that. But yeah, there is definitely a lack of those services on Kauai, as far as I know.
Yeah, senior citizen is a little difficult, especially they don't have anything, no insurance, no income, anything like that. So initially, you would want to get them some kind of some form of medical insurance, and get them linked up with some kind of service coordination. If they're elderly, there's a good chance they have some kind of health issues, health complications, or whatnot. And then that's when you can collaborate with those folks and see how you guys can work together to get those folks the help they need. I know there's a bunch of like transitional homes for elderly folks as well out here. But
yeah. Anyone else? All right, this next question might be is kind of directed at Art anyway. So are there any organizations that provide case management services to veterans?
Well, for our program, we provide case management services to homeless veterans. The Section 8 HUD-VASH program provides case management for permanent supportive housing to veterans that are in the program. I guess some of the outside agencies, if they are veterans potentially and they are homeless, they could get some case management services. I know IHS does provide that. Kalihi, Palama, US Vets provides that. If they are suffering from severe and persistent mental illness, AMHD could be a source where they could get a case manager to assist with their severe mental illness. So yeah, those are kind of the ones that I'm aware of. I don't know if Castro has anything else to add to that, as far as like outside agencies that provide case management.
No, just MSD case management, maybe even CCS. Have them complete 1157 with a psych eval, and then get them linked with a community-based case manager.
Yep. Thank you. Question about PPE. So were clients less engaged or more hesitant to work with you or with your PPE on? I would think that would make you more scared. So was PPE an actual sort of barrier to, not just a physical barrier, but a sort of conceptual barrier for clients in accepting help?
I think for us at Malama Pono, it definitely was at first, especially when we rolled out with those, spacesuit PPEs, where we're almost completely covered. It was definitely, it just seemed, I think for the house's population we were dealing with, it just seemed so, I don't know how to put it, like almost like government agency, or like they just didn't trust us in how we were rolling out with that. Almost like we were trying to get information almost on them, not so much as trying to help. So now it's been much different. Of course, everyone's kind of gotten used to the masks, and we've brought down our protocol. So now it's just more of an even playing field. I feel like it isn't a hindrance anymore.
I think initially a lot of our clients were kind of they took offense to us wearing these masks and gloves. A lot of them were offended, like, "Nah, we don't have this COVID. What do you think we are?" You know what I mean? So it got to the point where we eventually gave them masks and gloves as well, just so we were all kind of like on the same field. At least that's what our experience was in the beginning.
Thank you. So I apologize. At this point, we're not going to be able to get to all of the questions, so I will ask the next one. But at noon, I will stop so you all can go to the next plenary. So the next question looks like it's specifically for Ramon. How do you get clients to follow up with you on a regular basis for tobacco cessation?
That's surprising. Of course, you're going to get all over the board. You're going to get people who drop, people who stick, people who don't stick. And so you have to give everybody the same chance. I am surprised pleasantly that some people are sticking to it. And if I don't show up, they're trying to get a hold of me through somebody else and say, "Hey, I'm out of gum," or whatever was working for them. And also, some of them is not even the gum or the patches. It could be something like as easy as toothpicks or something like that, the coloring books. And so as long as you keep doing it, you keep giving people their, whatever services they're entitled to, then you're going to have people who are going to be successful. And yes, some people are going to be a little more difficult, but just keep going at it. And so I don't know if that answers the question, but just being consistent, that will be my answer. Just be consistent and keep going.
Thank you. All right. The next question, what services are available to homeless veterans who may not meet qualifications with the VA? I'll answer part of this actually a little bit. So through CES, actually there is housing services through US Vets and Catholic Charities through Rapid Rehousing, SSVF programs. So that goes through the CES program at Partners in Care as far as housing goes. So if it depends on their discharge eligibility though, and pass the rest to Art.
Yeah, so for the rapid rehousing, they need to have a other than honorable. They could potentially have a bad conduct disorder, but it depends upon if it was a general or specialized court martial. So we need to see their DD 214 to determine eligibility, and that is through US Vets and Catholic Charities. They could also be eligible for the grant per diem program, which is the transitional housing out at Barbers Point. Individuals that served in the military and aren't eligible for those type of services could potentially receive a referral through Mike and the CES services. As long as a VI spit out is completed, we can see what available resources are there and get them a referral.
Absolutely. All right, it's now just a little after noon. I apologize for running over. Thank you everyone for being here, and thank you to the panelists very, very much. Really appreciate it. So please enjoy the rest of the conference, and see you all later.